Well, besides social distancing, what else can we do to protect ourselves from COVID-19? CGTN's Ge Ning gives us some tips on self-protection.
How do you protect yourself from getting infected? Yes, the coronavirus did break out in China, but with the WHO declaring it a public health emergency of international concern, people around the world are keeping a close eye on how the epidemic is progressing, the number of infections, how the patients are being treated or how many have recovered, the development of the vaccine and medicine research, etc., etc. But most importantly, how do you protect yourself from getting infected? The virus gets passed on to someone by respiratory transmission, so there's nothing you can do that protects you better than just wearing masks and always keep your hands clean. Simple as that. There have been rumors about eating certain herbs as prevention, but no, just wear masks. There are many types of masks you can see either from the internet or your local shops, so you may be asking, which one is the best for me? And what's the difference between them? There are 4 types of masks that we see normally. First is the disposable masks. These masks are recommended when you're not surrounded by a crowd. Second, the medical surgical masks. These are recommended for those suspected cases and people who use public transportation a lot, taxi drivers, sanitation workers, and service workers. Both of these types stop mouth and nasal discharge of pollutants, but a medical surgical mask has 3 layers and is also waterproof and can filter airborne particles. Third, the well-known N95 masks. Frankly, the N95 masks are designed to achieve a closer facial fit and more efficient filtration of airborne particles. But that's about it. So unless you're in a really crowded place or somewhere that doesn't have good ventilation, you don't have to wear it. And bear in mind, N95 masks with breather valves are for those who are healthy, because the valve only works one way. It stops the droplets from coming into the mask, but not the other way around. So if you are infected, then your droplets will be sprayed out into the air and infect others who don't wear masks. Finally, the medical protective masks. This falls under the N95 rating, but it doesn't have a valve. The filtration of this type is the most efficient, and it's for medical staff who work at fever clinics and isolation wards, which is not necessary for people like us to wear. And now, to how to wear it properly. To wear a disposable mask or medical surgical mask, make sure it's the right way around by checking if the nose piece is up and the text is on the outside. Stretch out the creases to cover your nose, your mouth, and your chin. Press downward and outward to make sure the mask is sealed and fitted on your face. You should change your mask every 4 hours or whenever it's soiled. When you finish with the mask, simply take the straps off and be in it. Do not touch the surface of the mask. That's it for today. I'm Ning. I'll see you next time.